COVID-19 pandemic is really putting a lot of pressure on families in a lot of different ways. So families are dealing with disrupted routines, stress related to school, stress related to finances, fear of infection itself, fear around illness of family members. And when this is happening, you of course have a lot of stress on each individual family member, and then this inevitably leads to things like family conflict, stress in parenting. And the ways that families support each other, the ways they communicate, the ways they solve problems during this time can make a big difference in the mental health outcomes that you see among children and also among the caregivers themselves.
What's remarkable about this time right now with so many changes going on is perhaps parents would be more open to therapy or family therapy. This may be a time to really engage families.
So our goal in this project is to provide and then evaluate a family therapy intervention that helps families to reduce conflict, improve communication, problem solving, and parenting during this pandemic experience. So we hope to help families with their current problems and strengthen them to prevent more serious problems from developing over time. So the interventions that we're talking about really focus on teaching families skills for things like communication and problem solving, and then as actively as possible to help families practice those skills. So our team and I in Kenya have tested some of these family intervention approaches in very resource constrained communities there. And we have found that when we work with families to teach them these family communication skills and problem solving skills within their communities by lay providers who do not have professional backgrounds, they are showing significant improvements in their family communication abilities. They're showing improvements in the ways they solve problems together. When we have trained lay providers in family therapy strategies that are typically delivered by professionals, they've worked with families in homes, and we've seen improvements at the family systems level and also in the dyadic relationships within families. And by that we mean between the couple, between the parents and the children, and then in the social and emotional and behavioral health of the children themselves. So we are hoping now to pilot some of these strategies here in Durham, North Carolina, where we're also seeing that these resources are constrained. And perhaps they have been before, and now we're seeing where these disparities lie. So we are hoping to train lay providers here and also see some of these same benefits among families who are experiencing these large stressors associated with the pandemic.
There are several things about this particular study that would be different from what's been done before. First of all, the different format, that it might be provided by lay providers or at least not experts, and that it'd be done now during a time of social isolation. In addition to that, we believe that parenting is very emotional work. Being part of a family is emotional, and a lot of times there's positive emotions involved in that. Right now, with the stresses of life, there could also be a lot of negative emotions involved. And so one thing that we're going to do, which is novel, is to pair up sets of positive emotions at key points during this curriculum. So for example, in studies in the lab, we know that fear and worry can be kind of loosened up and mitigated when you feel grateful. So we might have a small gratitude practice. You know, we want to reach socially vulnerable families, and but we don't know everything as researchers. And so the approach that we're going to take here is to talk with leaders in parenting and schools and other interventions and get their thoughts and perspectives and figure out what community members most want to learn and who would be willing to participate with us. I don't know if this intervention will allow for that, but it will certainly validate that this is hard and important work, and hopefully give the hope and encouragement to keep going and get through it. Someday this pandemic will end.